vitality, and confidence. If you care about your health and your relationships, make sure to hit that subscribe button, give this video a quick like, and drop a comment below telling me, where are you watching from today? I always love seeing the community we're building together around the world. All right, let's get into it. Now, here's the myth I want to dismantle right away. Most men believe breasts are primarily just for visual attraction, that women don't really feel much there beyond the superficial. That couldn't be further from the truth. The breast, especially the nipple and areola area, is loaded with nerve endings. For some women, that stimulation alone can send waves of genuine arousal through the entire body. For others, it's the emotional connection of feeling truly held, valued, and seen. And when you learn to approach this with patience, respect, and just a little technique, it's no longer simply about touching her chest. It becomes an entire experience that can unlock deeper intimacy than you might think possible. Now, I'm not giving you random magazine advice here. I've worked with thousands of men and couples over the last 7 years. I've seen the clear difference between men who rush or fumble and men who slow down, learn her signals, and use their hands, mouth, and genuine presence to truly connect. And believe me, women can tell the difference instantly. So let's dive into the 9 steps that transform breast touch from an awkward afterthought into a confident, connected source of profound pleasure. Tip number 1, start with consent and curiosity. Nothing is more genuinely arousing than safety and trust. Instead of guessing what she might like, simply ask, how do you like your breasts touched? Softer, firmer, with my hands or my mouth? Any areas I should avoid? That one relaxed question immediately lowers her anxiety, builds trust, and gives you an actual roadmap for what she enjoys. You can even agree on a simple communication system while you explore. Green means more, keep going. Yellow means slow down, soften your touch. Red means stop, let's change it up. It takes pressure off both of you and creates a playful sense of genuine teamwork. Tip number 2, slow way down, start wide. Here's where most men completely blow it. They go straight for the nipples. Too fast, too soon. Instead, begin outside and work your way in gradually. Warm hands, broad strokes along her upper chest, sides of her ribs, and that tender curve where breast tissue meets her torso. Add kisses at the collarbone, neck, and jawline. Why does this matter? Because the nervous system doesn't jump from neutral to intense arousal in 30 seconds. You're giving her body the time it needs to shift from guarded to receptive. That's when touch becomes electric instead of uncomfortable or ticklish. Pro tip, a small amount of unscented, body-safe lubricant makes skin glide effortlessly and prevents any friction that might feel irritating. Tip number 3, hold with intention, not a pinch. Most guys either poke or squeeze, wrong move. Instead, think cradle, not pinch. Use your whole hand to gently support the weight of her breast. Alternate gentle compressions with moments of stillness. Here's the biology behind this. That kind of confident, caring hold signals both safety and desire. Her body naturally relaxes, oxytocin levels rise, and her arousal begins building organically. And watch her cues carefully. Her breathing changes, soft sounds, or her leaning into your touch, that's your green light to continue. Tip number 4, don't forget the areola. The areola, the darker circle around the nipple, is just as sensitive as the nipple itself, sometimes even more so. Try tracing slow circles or gentle spirals that tease toward the nipple, but then back away. Support the tissue underneath so it never feels like it's being pulled or stretched uncomfortably. That combination of teasing, anticipation, and supportive touch can send genuine sparks through her entire chest. Tip number 5, dimmer switch, not a light switch. The nipple is powerful, but treat it like a dimmer knob, not an on-off switch. Start with feather-light strokes. If she responds positively and wants more, try rolling gently between thumb and finger, or a press and release motion. Avoid sharp tugs or abrupt movements. Those can feel painful rather than pleasurable. And remember, lubricant prevents uncomfortable friction on delicate skin. Build intensity gradually, always checking in with her responses. Tip number 6, use your mouth thoughtfully. If she's comfortable with oral stimulation, begin with warm breath, then trace slow movements around the areola before touching the nipple directly. Gentle suction can feel amazing. Clamp-like pressure or teeth almost never do unless she specifically asks for it. Want to try playful grazing? Practice on your own forearm first to know exactly how light to keep it. That way, you'll have perfect control when it matters. Tip number 7, let words and breath amplify touch. Touch alone is powerful, but words and breath deepen the entire experience. Quiet, genuine compliments, a low, calm voice, short questions like more like this or softer here, and match her breathing pattern. When you exhale slowly and deliberately, it relaxes both of you. It signals safety to her nervous system, allowing genuine arousal to expand naturally. Tip number 8, pair breast play with what gets her over the edge. Here's an important truth. Research consistently shows that most women reach climax most reliably with consistent clitoral stimulation. But when breast play is paired with that, it can amplify pleasure dramatically. So keep one hand or your mouth on her breast while your other hand or even a small, quality vibrator focuses on external stimulation. The key principle: change only one variable at a time so her brain can fully lock onto the sensation without getting overwhelmed or distracted. Tip number 9. Temperature and tools only with enthusiastic yes. For the more adventurous couples, a cool fingertip, a warm palm, or breath across the nipple can create contrast that heightens sensitivity. If you explore any kind of tools, choose high-quality, adjustable devices. Start with the lowest settings, keep sessions brief, and always remove them immediately if there's any discomfort, numbness, or color change. Skip these entirely if there's pregnancy, heightened sensitivity, injuries, or any medical concerns. Here's your practical framework. Talk first. Consent and curiosity always come before touch. Go wide, then close in. Let arousal build naturally and organically. Use intention, not impatience. Support, cradle, and care for her body. Read her cues, breathing, sounds, body language. These tell you everything. Layer sensations. Hands, mouth, words, and pairing with what actually brings her to climax. And afterward, don't just roll away. Hold her. Breathe with her. Let everything settle naturally. Many women say that decompression and aftercare is the most satisfying part of the entire experience. Now, I want to remind you of something important. You don't have to be perfect at this. This isn't about memorizing fancy tricks or complicated steps. It's about being genuinely present, paying close attention, and letting her body teach you what she enjoys. Some days, she may absolutely love this kind of touch. Other days, she may not be in the mood for it. That's completely normal. Respect that, and she'll trust you even more the next time. So, gentlemen, this is how you stop breast touch from being a quick, thoughtless afterthought and turn it into a deeply intimate, arousing experience that makes her feel safe, desired, and fully alive in your hands. Remember, age does not limit intimacy. If anything, maturity gives you the patience and confidence to approach this better than younger men ever could. So start slow, be intentional, be curious, and you'll not only give her significantly more pleasure, you'll also deepen your bond as a couple in ways that matter far beyond the bedroom. If this helped you,